This is a podcast from Torfaen Talks CIC.
Welcome to the Torfaen Talks CIC Dementia-Friendly Gwent podcast series. In this episode, we're stepping into the hospital setting to explore how the Dementia Hospital Charter is improving care and how meaningful engagement can transform patient experiences. We'll hear from those working on the front lines to make hospitals more dementia-friendly and compassionate places. So on the theme of improving experiences in hospital settings, joined today by Elisa and Donna. Donna, what is the Dementia Hospital Charter? And why was it developed?
The purpose of the Charter is to enable hospitals to create a dementia-friendly care experience, as well as environments that meet the needs of people with dementia, but also their families, carers and supporters. It acts as a short, clear statement of key principles that contribute to a dementia-friendly hospital. The Dementia-Friendly Hospital Charter outlines the principles that a dementia-friendly hospital should achieve over time, and this should fully support the Dementia Action Plan for Wales, with a vision there is to create a society without stigma, where people living with dementia continue to go about their lives and are understood by the wider public who know how to provide support. The purpose of the Charter is to enable hospitals to create a dementia-friendly care experience and environments that meet the needs of people with dementia in Wales, really.
Also, what does a truly dementia-friendly hospital environment look and feel like for somebody living with dementia and their carers?
This isn't always a straightforward answer, as people's experiences are often individual and needs and preferences will differ. The environment in which we live, we work and that we are cared for makes a real difference to us all. And all of us can become anxious and frightened when we go into hospital. We need to remember how much more of a challenge this can be for people with cognitive problems and dementia. Research has repeatedly confirmed that a supportive and welcoming environment can have positive effects both on those who visit hospitals, and whether that be patients or carers, but also for people who work in them. Feedback tells us that when people come into hospitals, care homes or any settings, it's often the small things, whether that be things like clear signage, light and airy rooms, or even something like her handrails can make a big difference to people. Being admitted to hospital is potentially a frightening experience, and it can cause things like agitation, disorientation and distress in any patient. But for someone with dementia, this anxiety is often increased by unfamiliar surroundings, heightened sensory challenges that are associated with a busy place like hospitals. Some of the projects have found that calmer and well-lit, more legible environments with good signage helping people to feel less agitated and more able to navigate these unfamiliar places. There's a real demand at the moment for day room spaces within hospital settings to allow social interaction with others, engagement in activity, things such as just enabling a dining experience, and even benefiting from new therapy areas within these spaces to aid rehabilitation. People with dementia often want to walk about, and yet there are few day rooms available, particularly in our acute hospitals. So teams have been creating some small spaces for people to sit away from the bedside and within the ward areas and along corridor spaces, but it's also recognised that patients can get bored when in hospital, and this has been tackled by the Meaningful Engagement programme, increasing the range of resources that are available to support a person-centred approach to care within our hospitals.
So to Elisa, what does meaningful engagement look like in a hospital setting?
Thank you. So meaningful engagement can be as simple as asking for and addressing someone with their preferred name, so Bill instead of William, for example, and then sharing that information via the bedside boards, so it can notify other members of staff, volunteers and beyond. When we talk about meaningful engagement, people assume we're looking for 10 patients in a day room playing bingo or quizzes, and while that would be lovely, it's only meaningful if those 10 patients want to be in the day room playing bingo. It can be much simpler than that. Firstly, knowing if your patient has a diagnosis of dementia, to identify that we may need to make reasonable adjustments when providing care, asking relatives if the person has a "This Is Me" document and utilising the document if it's available, or signposting or providing a copy to be completed, allowing people to maintain their independence by supporting them to dress rather than doing it on their behalf. It can be more time consuming, but it gives that person a sense of purpose and achievement. Involving families and carers is also a meaningful way to learn about your patients, their likes and dislikes, what makes them anxious so that we can try and avoid that? Can we access a radio to play some of their favourite music? We also have a variety of resources available to support the implementation of meaningful engagement. We've got things like therapy cats, dogs and dolls, fiddle pillows, reminiscence and conversation starters. Some of these are patient-specific resources, and that's why it's important to get to know your patient. You wouldn't necessarily give a patient who dislikes cats a therapy cat just because they have a diagnosis of dementia. And while these are great resources, they may not always be necessary. Implementing organic, meaningful engagement, communicating with our patients during any interaction, and including this in our daily routines can hugely impact the standard of care delivered when supporting people living with dementia. So to help as many health and care organisations as possible to develop more supportive design for people with dementia, in 2014 the King's Fund developed a suite of environmental assessment tools to use across the health and care settings. Hospital environments are busy places which can be confusing for people living with dementia to navigate. People living with dementia may be attending hospitals for routine appointments. Some might have been admitted in crisis, via accident and emergency, and some might be on longer stay wards. So using the hospital assessment tool can help to highlight ways in which a variety of changes may be made to make spaces more understandable and comfortable for people living with dementia.
Donna, how are families and carers involved in hospital care planning?
Family and carer involvement in patient care is essential for holistic and person-centred care, but especially so in dementia care where community and continuity are key. There are some practical ways that healthcare professionals can facilitate this, things such as creating an inclusive environment, can invite family members to care planning meetings and ward rounds, ensuring that they feel welcomed and valued as part of the care team, providing clear communication, using plain language when explaining treatment plans, offering written summaries or visual aids if information being provided is complex, and encouraging questions and checking understanding, ensuring that what we've communicated has been understood. Always ensuring things like confirming the patient's wishes regarding family involvement is really important, balancing confidentiality with the benefits of shared decision making, and also things like offering education and support, providing training on dementia care strategies for families, and sharing resources on coping and behavioural changes and community support that might be available. There's also the use of things like structured tools like This Is Me or My Wishes Are that help involve families in personalising care. And also important is that we document family input in care plans so that's communicated consistently. But healthcare professionals play a really important role in facilitating communication with families and carers and promoting their involvement.
So what training or support is available for hospital staff to deliver dementia-friendly care? Elisa?
So the patient experience and involvement team offer a one-day dementia awareness and meaningful engagement session, and we deliver these once a month across various Aneurin and Bevan sites to make them accessible to all members of staff, including staff from care homes. We also offer dementia bite-sized sessions, and these are delivered via Teams. They're 1 hour sessions on different topics, including things like nutrition and hydration, oral care, future care planning, pain and brain health. We're also included in various training programmes across the Health Board, where we introduce improving dementia care and support services at induction level, including international nurses, newly qualified nurses and healthcare support workers. We're also currently liaising with facilities to support our facility staff to be more dementia aware, and this is including porters, catering and security. We also respond to requests to support wards to become more dementia friendly, utilising the King's Fund audit and providing dementia friendly signage and recommendations.
So Elisa, could you tell us a little bit more about some of the initiatives you have in hospitals to help support people living with dementia, like bedside boards, John's campaign and the Dementia Champions?
The person-centred bedside boards were initially developed as part of improving dementia care in hospitals, but every person in a hospital bed will benefit from the initiative. We know that if we get it right for patients with dementia, we get it right for everyone. And the boards offer an immediate, at-a-glance information at the bedside to help the multidisciplinary care team, patients and carers with individual patient care. It identifies risks, it can assist with communication communication, improve patients' awareness of their care team, their admission plans and the duration of admission, and significantly improve patient overall experience and satisfaction. Anybody can contribute to the completion of the boards, including family members, volunteers and any member of the care team.
And then John's campaign was implemented across an Iron Bevan Health Board to support carers to remain involved with the care of their loved ones. These are the people who know and understand the person best, and it's important that we remember that. Utilising their knowledge will support us to provide improved care. We accommodate flexible visiting for the carer to be able to visit outside of usual hours, to provide support and comfort to their loved one during their stay in hospital, and to provide a familiar face in what's often a very busy, noisy and strange environment.
We also encourage all our hospital areas to nominate dementia champions within their teams, and we use this network of people passionate about dementia care to provide updates and utilise as a link between us as the dementia team and their colleagues. As the areas nominate dementia champions, we hope that they would distribute and update their teams on any relevant training, updates or support services available to them via our distribution list and our newly launched WhatsApp community group. We currently have 205 dementia champions across an Iron Bevan and always welcome anyone with an interest and a passion to help improve dementia care.
So finally to Donna, what's next for the Hospital Charter and dementia-friendly hospital initiatives?
We're really proud of our progress and development in our ongoing work to improve dementia care across our hospitals, and moving forward there's an ongoing commitment to continue this work. So in terms of our national alignment, we continue to implement the principles of the Dementia Friendly Hospital Charter and the All Wales Dementia Care Pathway of Standards, ensuring our services meet the highest standards of care for people affected by dementia. More locally, our action plan, we've got a refreshed 3-year action plan that sets out clear priorities for embedding dementia-friendly practices in every hospital. This is guided by the Charter and the national standards, focusing on a person-centred care and family involvement as well. In terms of commitment and collaboration, by signing up to the Charter, we affirm our commitment to improving experiences for patients and families, and we're actively engaging with our national groups to share progress, learn from others and identify areas for improvement. This collaborative approach will ensure consistency and shared learning across Wales. And looking ahead, we'll continue to monitor our progress, celebrate our achievements and work together to make our hospitals truly dementia-friendly environments.
Donna and Elisa, thank you.
Thank you very much.
Thank you.
That wraps up our conversation on the Hospital Charter and meaningful engagement. It's clear that small changes can make a big difference in how people living with dementia experience hospital care. If you're working in healthcare or supporting someone through a hospital stay, we hope this episode has offered practical insights and inspiration. Thanks for listening.
This is a podcast from Torfaen Talks CIC. For more details about what we do, look on our website, torfaentalkscic.org.uk.